Good morning. Welcome inside the WVLT newsroom as we bring you continued coverage of the votes happening in Washington, D.C. this week as lawmakers are taking a look at what President Trump is calling his one big, beautiful bill. Many dubbing this the biggest bill he has brought forth in his second time as president of the United States. Right now, lawmakers are still in House chambers. They are taking a look at this bill. Hakeem Jeffries is going on 5 hours. The Democratic leader of his speech is supporters of his conference are rising behind him to clap again as he goes on more than 5 hours before House lawmakers are set to vote on this bill. If they vote on this bill, no changes from the Senate. They will send it on to the president's desk for his signature. He had imposed a self-imposed deadline of tomorrow, July the 4th, to get that done. If they made any changes overnight, it would then have to go back to the Senate for a look. And if they made any changes from there, it would go back to the House and you have a ping pong situation there. But House Republicans working overnight to try and get enough of their conference to get this bill to the president's desk. There are a lot of Republican hardliners who say it simply raises the debt ceiling too much and they can't simply support it on the idea of fiscal responsibility. Knox County Representative, East Tennessee Representative Tim Burchett told national outlets yesterday that he was on the fence, was undecided, but was leaning towards passing it. A lot of Republicans saying the spending on border security and defense is simply too much to pass up. But what this bill also does is cuts almost $1 trillion of spending over 10 years to Medicaid. A lot of folks raising that as a serious red flag of this piece of legislation, saying that it is going to hurt rural hospitals the most. A recent report from the University of North Carolina Shep Center shows that 338 rural hospitals across America are at risk of closing, including just less than a dozen in the state of Tennessee. Our station in Nashville, WSMV, actually did a report on this earlier this week, as one of those hospitals is in Wilson County. One of the fastest growing cities in Tennessee, Lebanon, is at risk of losing its local hospital. Here is a report by Courtney Allen as that news broke.
People who live in Wilson County tell me that they're concerned about this hospital, the only one in the county, possibly closing. Roger Holman and his partner are filling up in Lebanon, within eyeshot of where Holman's family's been getting medical care for decades.
We've used that hospital. My mother, before she passed away, was a regular patient at that hospital.
That hospital, Vanderbilt Wilson County Hospital, is among 9 Tennessee hospitals that researchers at UNC Chapel Hill believe could close if President Donald Trump's One Big Beautiful Bill Act passes. The bill includes more than $1 trillion in proposed cuts over the next 10 years to the Medicaid program, which is a major source of money for medical centers. Senate Democrats believe rural hospitals like this one would be disproportionately impacted.
If you have to go 40 miles, further, to a hospital in Nashville, chances of you being saved are less. And so, we're talking life and death here.
Gordon Bonnyman with the Tennessee Justice Center says it's not just rural hospitals that would feel the cuts. He says half of Tennessee's children rely on the state's Medicaid program, TennCare.
Children's hospitals that serve both urban areas and rural are very much affected.
Vanderbilt told us, quote, "We have no plans to close any of our regional hospitals." We also reached out to Tennessee Senator Marsha Blackburn's office. In a statement, she says the bill, quote, delivers much needed support for rural health in communities across Tennessee by creating a rural health transformation fund that would provide $50 billion to strengthen rural hospitals through enhanced recruitment and training of doctors. Holman hopes this hospital sticks around.
I think it's a life-saving thing.
Courtney Allen, WSMV4.
Republicans say that $50 billion in funding to rural hospitals would make up the shortfall caused by the cutting in about $1 trillion over 10 years of Medicaid funding. But many Democrats say that simply is not enough to make up the windfall that you will see if that $1 trillion disappears. But again, Republicans saying we can do this. Also, they're putting more onus on the states to get this done and to use their funding to fill that gap to bring health care to the millions that could possibly lose it if this bill is passed here by House lawmakers shortly. This is a look at the hospitals that are that could be at risk should this legislation pass, according to the Shep Center at the University of North Carolina. About 9 across the state of Tennessee, only one of them in East Tennessee, that's the hospital in Unicoi County, would be at risk according to the algorithm that the Shep Center uses. That's a percentage of Medicaid funding and how many years, at 3 years at least, has the hospital shown a negative profit return. Again, only one in East Tennessee. There is the one dot that shows it right on the Tennessee line in about Claiborne or Campbell County. That's just our map system is counting the Middlesboro ARH Hospital, which is in Kentucky, as right there on the line. So it just kind of confuses that, but make sure that that one, if you're counting this, that counts for Kentucky. The thing about Kentucky is 35 rural hospitals are at risk of being lost if the $1 trillion over 10 years is cut. Governor Andy Beshear saying that could be 20,000 positions. In District 5 alone, that's almost all of Eastern Kentucky. That's Representative Hal Rogers' district. If this bill passes, according to the Shep Center and their algorithm, 16 rural hospitals would be lost. It would leave, according to my calculation, only Hazard, Pikeville, Corbin, London, and Somerset as the only cities in Eastern Kentucky that would still house a hospital for folks to go to. You could be looking at hours-long drive for help for those individuals. We actually have done reporting on this long before President Trump was even elected for a second time in office, at the risk of losing rural hospitals in East Tennessee. Here was our report from last year.
Small rural hospitals are wonderful. It's friends and neighbors taking care of friends and neighbors.
For the last 5.5 years, Hal Leftwich has run Big South Fork Medical Center in Oneida.
If you can't provide those services locally, to at least get people into the system, stabilized, and start to manage their care, it makes it much more difficult for the big hospital and the little hospital.
As Chief Executive Officer, he is tasked day in and day out with making sure that his hospital is running smoothly and efficiently.
Rural health care has always been more difficult.
Leftwich heads a community hospital of about 110 staff members that operates on a budget of nearly $40,000 a day. Over the years, it's run into its challenges and hasn't been immune to the plight of other community hospitals in rural Tennessee.
We're it. The hospital, for a couple of different reasons over the years, has closed twice. And the workload that turns over to the ambulance service, for example, is tremendous.
A 2024 study by the Tennessee Healthcare Campaign shows between 2010 and 2021, Tennessee saw 22 hospital closures, many of them in the most rural reaching counties of the state.
Rural hospital is one of the 4 cornerstones of a community.
One of those rural counties facing the closure of a critical healthcare facility, Campbell County, and the loss of Jellicoe Community Hospital.
It is really a challenge. It's a challenge for the community, it's a challenge economically, and it's a challenge in every way you look at it.
County Mayor Jack Lynch is finding the complications of saving one of 2 hospitals in the county is draining other resources.
I find that every time a community hospital closes, it means about 20 more miles as an average that they have to travel for emergency care.
The same study by the Tennessee Healthcare Campaign found that in 2022, 59% of Tennessee hospitals operated at a loss, and 45% were at risk of closure. Jellicoe's situation is unique. It's positioned right on the Tennessee and Kentucky state line, complicating payout of state and private insurances.
I see their point. They have to make money to operate, but then you also have to take into account lives mean more than dollars. People are more important than money. District 5 Commissioner Tyler King is one of 3 who've been elected to serve the Jellicoe community. King was born at the hospital and worked there in the mid-2010s. For him, bringing back the only hospital within a 30-minute drive means more than a political win. You start thinking, what if my grandparents get sick and I have to rush them to Knoxville, and you don't realize how lucky you are just to have it minutes away.
While currently there is no answer for the future of Jellicoe's hospital, County Mayor Lynch says they're committed to working with the city to bring it back, and as a message to those who say the money just isn't there.
I personally want health care. I don't care about the profit. I want health care.
That was a story we did in 2024 covering the plight of areas like Jellicoe and attempting to keep their rural hospitals. Again, you're looking right now at Hakeem Jeffries, the Democratic or House Minority Leader, Democratic leader, talking for more than 5 hours this morning as Democrats try and stop what the president calls one big beautiful spending bill that he has self-imposed a deadline of tomorrow, the nation's birthday, 249th, to get signed. Further in on that Jellicoe hospital, we have done reporting at Jellicoe since I got to WVLT in 2020, and it's been on again, off again. It's going to be brought back. It's closed again. It'll be brought back. It's closed again. Again, it's now looking at possibly someone stepping in to fill that void, but it still remains to be seen if that's a viable move forward, especially now with the possibility of $1 trillion of Medicaid funding being cut over 10 years. That could put that hospital's future even further deeper into murky water than it already is. We took a deeper dive into the issues at Jellicoe. Here's that story.
For years, the teetering of Jellicoe Community Hospital's future has stressed every resource in Campbell County.
Rural hospital is one of the 4 cornerstones of a community.
Mayor Jack Lynch inherited the loss of Jellicoe Community Hospital, one of 2 in his county of nearly 40,000 people.
But still, we want good medical service in the rural areas.
Mayor Lynch's county is divided by a massive mountain that puts power behind the need for more than one single hospital.
It has been a struggle for the folks in Jellicoe. For the county, it means, our ambulance service is sorely vexed now.
Right now, people in Jellicoe have 2 choices: driving north to Baptist Health Corbin or south to La Follette Medical Center run by Tenova, a nearly 30-minute drive on Interstate 75, either crossing a mountain or state lines to get emergency care.
It slows us down from the expansion that we need.
That expansion is another ambulance to cover Jellicoe. More growth for a rural county, Mayor Lynch saying, without reliable health care all over, that's not possible.
Without great health care, your lifespan is a little shorter. Your mortality rate is a little higher. Your life expectancy is a little lower.
While they await to hear news on if someone can run Jellicoe Community, the mayor makes his wishes clear for what he wants in his northernmost city.
I personally want health care. I don't care about the profit. I want health care.
Again, these are the hospitals that the Shep Center at UNC Chapel Hill, University of North Carolina Chapel Hill, says are at risk of closing if $1 trillion worth of Medicaid funding is halted over 10 years in the one big beautiful bill. It is important again to note that Republicans have created an avenue to create about $50 billion worth of new funding for rural hospitals. Tennessee U.S. Senator Marsha Blackburn says that would allow them better training, better funding, better ability to get well-trained and adequate doctors into these rural hospitals, despite the loss of $1 trillion of Medicaid funding, which they say is vital to the survival of a lot of rural hospitals. What you're seeing right now on the other screen next to me is Hakeem Jeffries, the House Minority Leader, giving a more than 5-hour speech attempting to delay a vote in the House today that is set to send the one big beautiful bill to the president's desk as long as House leaders did not make any changes to that bill. Again, not to be tongue-in-cheek, it's a big bill with a lot of spending in it, but one of the things that is opening a lot of eyes is the spending and the money that's being taken from Medicaid and readjusted to other parts. It also raises the debt ceiling. That's why this vote isn't as easy as sending it to a vote. All Republicans hopping on board. Many hardline Republicans are saying the debt ceiling is something we're not willing to mess with. The rising of the debt ceiling is not something we're willing to vote for. Thomas Massey of Northern Kentucky, one of the Republicans who says, this is a non-starter for me, and has been called a grandstander, is now being primaried by the president as he gets ready to run for re-election in 2026. We're going to be keeping an eye on this throughout the day. Again, of course, we're also keeping an eye on the one big beautiful bill and how it might affect hospitals across the state of Tennessee. Again, 35 hospitals in Kentucky would be at risk of closure, according to the Shep Center at UNC Chapel Hill. About 9, I believe the number is, in Tennessee. Only one of them in East Tennessee, and that is in Unicoi County. We'll continue to keep you updated on the One Big Beautiful Bill vote throughout the day, and of course the impacts it could possibly have on rural hospitals right here on WVLT. Our news continues at noon and 3:30, and always inside the WVLT News App.